So what are the consequences of living with GERD and not getting treatment for it? The spectrum changes, and most of the consequences are related to how long you have been living with the disease. If, for example, your symptoms have been present for a month, you probably will have different consequences than someone that has been living with the symptoms for 20 years. So acid coming up into the esophagus constantly, imagine, is going to cause some problems because the esophagus is not designed to resist acid. The stomach is designed to resist acid, but the esophagus is not. So if the acid is coming up into the esophagus, it can cause burning, it can cause inflammation, it can cause narrowing, and if those changes persist for the long run, the esophagus is going to change. When there is a change in the esophagus lining, now becomes more dangerous because the esophagus is changing now to a pattern that will resist acid. But this pattern, it is a risk factor for more problems. This is called Barrett's esophagus. Barrett's esophagus is also a precursor to developing esophageal cancer in the future. So let's just dive deeper into some of the consequences that we have discussed. For example, esophagitis. Esophagitis relates to an inflammation of the esophagus. It comes in different flavors. We have grade A esophagitis, B, C, and D. All the esophagitis classification does is to guide us as diagnosticians and physicians to understand how bad the acid reflux is for the patient. Grade A is when you have mild burning. Grade D is when you have a big deal of burning. Most of the patients that have esophagitis from reflux, they do seek medical attention, and the reason being is because they do experience pain. Now, if you don't have pain, does that mean you don't have acid reflux? That's not correct. You may have other atypical symptoms and still have a good amount of content from the stomach come back into your esophagus without inflammation. We medically call that non-erosive disease. That means you have reflux, but it's not burning. But it's still, we're talking about the same condition. So the next entity is Barrett's esophagus. So what happens with the esophagitis? Esophagitis has two options. Either it heals and goes back to the normal tissue, or that constant healing leads to a permanent change in the esophagus lining. That permanent change is what we call Barrett's esophagus. So understanding what the progression of the disease could be from a simple inflammation to a Barrett's esophagus, now let's understand what Barrett's esophagus is. So we have a permanent change in the esophagus lining. That lining is now more resistant to acid, but it is unstable. 6 to 10% of patients that have chronic gastroesophageal reflux disease can develop Barrett's esophagus. So Barrett's esophagus is almost like having a polyp in your colon. You know that if you have a polyp in your large intestine, that polyp may grow over time to become colon cancer. The same way works in the esophagus. If you have Barrett's esophagus, over time in the long run, this can turn into esophageal cancer. So Barrett's esophagus is the first stage towards developing esophageal cancer, but it is also the end stage from simple reflux to a more complicated reflux. So the odds of having Barrett's esophagus developing into esophageal cancer changes depending on the degree of Barrett's esophagus. So how much esophagus changed the lining? We call it short segment when there's only one small portion of the esophagus that changed, or large segment when there is a larger segment of the esophagus that is being affected. Also, Barrett's esophagus comes in different presentations. We have a Barrett's esophagus that has only mild changes, or a Barrett's esophagus that is already starting to turn into esophageal cancer, and we call that Barrett's with low-grade dysplasia. That means low-grade changes towards cancer. Barrett's with high-grade dysplasia, that means it's really now looking like it's going to become a cancer, or early esophageal cancer. So we go from simple, non-dysplastic Barrett's to low-grade dysplasia, high-grade dysplasia, and ultimately esophageal cancer. But Barrett's esophagus by itself is already recognized as a risk factor to developing esophageal cancer. And the risk of developing esophageal cancer, it is proportionally increased with the years that you have been living with the condition. So the odds of having esophageal cancer, if you've been living with Gerd for 20 years, it is going to be 14 times higher than a person that does not have esophageal cancer, that does not have acid reflux, pardon me. It is the same thing as saying if you do have a polyp in your large intestine, that can turn into a cancer. If you do have Barrett's esophagus, that can turn into esophageal cancer. So what happens is that if the disease then progresses to esophageal cancer, we have a very bad entity. And I say that because esophageal cancer is a very aggressive tumor. By the time we come to diagnose esophageal cancer, more than 30% of it has already spread to the lymph nodes. That means that it requires more advanced therapies, including radiation, chemotherapy, before we could actually remove it surgically. So esophageal cancer is a very aggressive form of cancer, and our goal is to prevent patients from getting to this stage, because getting to that stage is quite lethal. So before we come to esophageal cancer, we should have had Barrett's esophagus. Before we had Barrett's esophagus, we should have had Gerd that was not treated. So please understand the sequence. This is not just a matter of diet or what I ate. It is a complete disease. So other risk factors of esophageal cancer are men are more likely to have it than women. Advanced age over 60 is more likely to present rather than earlier. And that makes perfect sense because people over 60s have been living with the condition for a longer period of time. Smoking is being associated with higher degrees of developing esophageal cancer. And obesity. Remember that we said that 1 out of 3 people with obesity also have Gerd. Now, please note that when I'm talking about esophageal cancer, I'm talking about the esophageal cancer that is related to acid reflux, which is adenocarcinoma of the esophagus. There are other forms of esophageal cancer that are not related to acid reflux. For example, squamous cell, that is more related to cigarette per se. But the adenocarcinoma of the esophagus, the one that is related to the acid reflux, always develops in the junction between the stomach and the esophagus. So it develops right where the problem is arising to reflux.